What are the differences in Toupet and Dor Fundoplication for GERD? Imagine having a way to stop acid reflux at its source with surgery that fits your needs perfectly. That's what Toupet and Dor Fundoplications aim to do. Both are options to help manage gastroesophageal reflux disease, but they do it in different ways. Let's explore how they differ so you can understand which might be best for you. First, the way they wrap the stomach around the esophagus is different. The Toupet procedure involves a 270-degree wrap at the back of the esophagus. This means about 3/4 of the stomach is wrapped behind the esophagus, providing strong reflux control. The Dor procedure, on the other hand, uses a 180-degree wrap at the front of the esophagus. It covers about half of the esophageal circumference and is often less restrictive. The typical reasons for choosing each surgery also vary. The Toupet is often recommended for patients with weaker esophageal muscles. Because it is a partial wrap, it helps prevent acid reflux while reducing the chance of swallowing problems. The Dor is mainly used when the surgery is combined with treatment for other esophageal issues like achalasia, especially after a procedure called Heller myotomy. It's less common as a primary treatment for GERD. When it comes to how well they control reflux, the Toupet usually does a better job. Studies show it is as effective as the full 360-degree Nissen procedure in stopping acid from coming back. The Dor, while helpful, tends to be slightly less effective in preventing reflux. However, some patients find symptom relief similar with either option. Swallowing difficulties after surgery are a concern for many. The Toupet has a lower chance of causing trouble swallowing because it is less tight than a full wrap. It's often preferred for patients worried about this side effect. The Dor also has a lower risk of swallowing issues compared to total wraps, but it might have a higher chance of reflux coming back over time. Surgical approach and how much of the esophagus is wrapped also differ. The Toupet's posterior wrap encircles the back of the esophagus, which can be a bit more restrictive but still allows some movement. The Dor's anterior wrap preserves the front structures, which can make the surgery safer and reduce injury risk. In the end, if you need a partial wrap that balances reflux control with a lower chance of swallowing problems, the Toupet is often the better choice. The Dor is more specialized, often used with other esophageal surgeries, and might be less effective for GERD alone. Both options are alternatives to the full Nissen procedure, which involves wrapping the stomach completely around the esophagus and can cause more swallowing issues. Understanding these differences helps you and your doctor decide on the best approach for your specific situation.